The most sad point it was she's going to the school, and Quranic school, and also the primary school. But every day she comes back and she's crying and she's saying that I'm not circumcised and the others are circumcised. And even when they are just going together and praying, they will say, stay outside. You don't have to come in our praying place because you are not yet clean. Yeah, so it's having a lot of pressure. That's why, I was just trying to tolerate for a long time, but now that's why I'm forced to find a way that I can just move her outside, out of the country.
But if anyone has the power to convince people of the need for change, it must be their DMOs, two individuals who enjoy enormous esteem among these loyal, tight-knit communities. Everyone here is very conscious of the fact that people who have received professional training abroad are far more likely to succumb to the lure of highly paid jobs in the cities or outside the country. For those close to the project, their doctor's steadfast commitment is a source of boundless pride.
Alas waxaan aragnaa anaga ayadoo leeyahay dhaqaatiirta anaga noo joogta dhaqaatiirta idan la mid heedo xamar joogtay guriga filooyin iyo baabuur qurqurxooneed watan dadkan oo ka aqoon badantiin maxay idin dhiga meesha ayadoo lagu caraaso lagu ka caamihayaan aan wax badan soo joogno.
When you see such kind of things, you have to think of the way that you can stay with your community and help them to develop. And even if you know something that your people they don't know, you have to share with them and you have to help with them. So that's the way that you can just grow up your country and your people. Because even if you are the best country in the world, peaceful area with a lot of money and everything, still you are foreigner in that country and you are not at home. And even just frankly speaking, later on maybe when you reach the age of retirement, you will be back in your country and you didn't do anything. So I think the mentality of just believing that the Somali professionals, they just go abroad, they will not come back. It's not for all, maybe it's only for some people.
However, with the end of CHISP's current grant in September, the project will find it increasingly difficult to pay its senior medical personnel and to retain those who hold the key to the entire health of this region. While many of the health service managers are confident they will be able to absorb this cost, not everyone is so sure.
We have poured a lot in terms of training these people, both externally and internally. We've done a lot here on the job. We've done a lot in other countries like Kenya. We've had people trained in anesthesia, for example, on how to give general anesthesia and have the patients operated by the doctors. We've had doctors exposed to surgical trainings. We have had nurses exposed to nursing. For example, the head nurse has just come from Hargeisa after 6 weeks training by WHO. So to lose these people and try to get them again will be a big problem. And so if urgent intervention takes place now to retain them, then the quality services will go on. And we are talking of sustainable quality health services. So the people are trained, but how do we keep them?
It's another day and another play in which the health workers of Elder are trying to convince their community of the need to abandon the old ways and move towards more modern and dependable forms of health care.
أنا قاعد أقهر أنا هي عاي واحد ليس أنت هي عاي مركب تاد وحاجة شيء يفون لا فهاي قبض بس بري كده من أكتر كوسان قمانو أنا صادق
Whether these communities continue to develop their health services and self-sufficiency is clearly no laughing matter. But for now, all the serious evidence points to a much rosier future for these people who have taken the management of their own health to their hearts.
haddii ku reesid diiday isbitaal loo qaado isbitaalka dii loo qaadan kaneeca laga sheego marka hadda haddii aan qiyaasana waxa hay dadkaas jaahilnimo.
I believe as public health servant and having served in several countries in the world since 1988 that these two committees have given the highest contribution towards their own health care. There's no other committee that had contributed that much and had done so much for their own welfare, that have helped themselves that much. And I think that they deserve to be helped more than any other community.
warjasba waa jecelnahaya hayadaha la jira horumar baan gaarnay indhaha fiiqayaa la helay dadka halkiisii fijiray ba heshiis dhex maray hareerahayno dhan cisbee talabay heleen oo hayada geeysayaago waxbaan hayn qofkii jirahaysay hood isaga dhimeen